Can everybody's attention please? It's 11:40. My name is Kali Reyes and I am going to bring this meeting to order. And we're going to go ahead and do roll call.
Marina, good morning.
Earl Molina present. Gerardo Mayo present.
Francisco Adame.
Hermano Duarte.
Roberto Sánchez. Jaime Risper. Jacob Vasquez. David Lopez.
Jaime Perez.
Mariano Morales.
Richard Chamberlain with Laredo Public Health.
Erica Lopez, Laredo Public Health.
Eliezer Contreras, Laredo Public Health.
Catalina Romero.
Victor Vasquez III.
Alessandra Reyes. Jessica Páez.
Mark Hurd.
Carolina Fernandez.
Freddie Cordova for District 8.
Carolina Braski.
Nancy Cadena.
Elizabeth Alonso Villarreal, present.
Lindsay Vasquez Vito.
Jessica Contreras Detox.
Margarita Garza.
Ana Masti Canales.
Alexa Huerta.
Thank you so much, Angie. Angie Flores. All right, thank you so much, everyone, for being in attendance. We have a full house and we're happy about that. We're gonna go ahead and skip the invocation for now until Pastor Reyes does arrive. And we're gonna move on to public comments. Are there any public comments? No comments. Thank you. We do have quorum, and I do want to say thank you to everybody who's here. For the commission members, there is an attendance form that is on the second page of the agenda. Please note that if you have been a committee member, that you are required to attend, and if you've had over 5 absences, it is cause for caution, and we do require attendance so that we can move on items. So I ask, Earl's going to reach out to you all individually to see if your commitment is still there, otherwise so that we can have somebody else appointed to represent. We are going to review the approval of the minutes for May 8th, 2024, and if I could please have a first and a second after review. Motion to approve. I have a first. Do I have a second?
I second.
I have a second. Thank you. All in favor?
Aye.
Any opposed? Motion passes to accept the minutes as written. Thank you. We're going to go ahead and move on to the administrative report. Dr. Chamberlain.
Good morning, everyone. Right? Yeah. 18 minutes. Good morning, everyone. We appreciate everybody being here. I wanted to give a brief overview or a recap of the ORS conference that that I attended, and of course, Ricky Hurd attended to from FIRE. Let me go ahead and push that over. I don't know if anybody actually knew about the overdose response strategy that the DEA or the HIDTA, the High Intensity Drug Trafficking areas, and the CDC or the CDC Foundation puts on this conference. This was new to me actually, that they have this, which is a partnership between public health and public safety. And I definitely encourage members of the community to attend this in future years to come. So just a little recap of what the ORS is an unprecedented and unique public health, public safety partnership between the Office of National Drug Control Policy and the U.S. Centers for Disease Control and Prevention through the support of the High Intensity Drug Trafficking Area Program and the CDC Foundation. At its core, ORS is an example of cross-agency interdisciplinary collaboration with a single mission of reducing deaths and saving lives across the United States. There was many individuals from all over the United States sharing their success stories or their stories that have taught us a lesson. In the efforts to be able to help elevate communities across the United States, to take something back with them and to be that person or that agent of change in the community to reduce overdoses. It was also we were also very fortunate and gratitude expressed to them for allowing Laredo to be part of the conference. So as you can see there, it was DEA and City of Laredo that were presenting to one of the breakout sessions regarding the numerous harm reduction strategies that we have employed here in the City of Laredo. So I know I said it last time, I'll definitely say it again. I mean, this is a community effort. We are making headways because we are working together collaboratively. We cannot do this alone. We cannot stand in silos. I mean, we're basically holding hands, hitting this hard is what we're doing, and we are being loud about it. So they appreciated this about our community, and we did get feedback and requests from another jurisdiction to be able to share our work with them, even as far as what surprised me, that San Francisco came to connect with us about what we're doing. That I would say it's the city of Laredo. So absolutely, we are here to share our best practices and be able to amplify what we're doing here in other communities as well. So thank you to each and every one of you who has contributed to this momentum that we have in this moment of time. Ricky, I'm going to put you on the spot. Would you like to say anything? Okay. I wanted to be inclusive because he was also there. During the ORS, they shared with us a pretty cool tool that I definitely geeked out with. And I don't know if anybody else will, but it's something that I want to make sure that everybody in the community was very much aware of. So this was a presentation put together by one of the CDC Foundation's public health analysts, and he went into this detail of what is an overdose fatality review, a series of confidential individual death reviews by a multidisciplinary team to effectively identify system gaps, and innovative community-specific overdose prevention and intervention strategies. So I know with PD, we don't have anybody here. I was gonna inquire of them if we do have this fatality review. I know we have it for children in the community, which of course includes our medical examiner and 2 physicians and a member of our staff here at Laredo Public Health. But this is something for us to think for the future, so that way we can really get down into those social determinants of health. Of course, without sharing protected health information and being still confidential about the information that is being shared, so we can make those differences. So this is where it started off to get to the tool, and I'm getting there. Then, of course, the overdose fatality review, which the expected outcomes by adding social determinants of health and equity information is to learn which social determinants of health and health indicators contribute to the risks of a fatal overdose, address the lack of access to treatment and recovery support systems, provide necessary data to justify decisions and allocate appropriate resources, and identify upstream needs. And where we really want to get into is into the root cause, not just being upstream, which is coming out of groundwater, not just where the river begins. While there, I did want to just plug the annual report, and this is has some good information. I'll have Angie send this out to everybody just so that way you can be able to click the link. It'll be there. It's actually down there at the bottom. It's a hyperlink. So this is the Overdose Response Strategy Annual Report. This is something that is pushed out. This is something that's new to me as well. I don't know if anybody in this group was aware of this. Yes? No? Show of hands? No? So this is great. This is why we go to these conferences, so we're able to bring back this type of information and share with the members of our community. So this report has some really good information. I definitely encourage every one of you all just to take a look at it when you have a quick break and need something to read. So then he discussed the overdose fatality review equity tool. And so let me click on this. It didn't work. I apologize, y'all. We'll make sure, this is just a round to introduce it to the group, because we do have our communications team that is connecting directly with the public health analyst to teach us how to use this tool. And what the tool is, I can give you a quick highlight of it. It is an interactive ArcGIS map. And I know at the most recent meeting that we had, there was discussion to update the services that are available in the community. What better way to do that actually? By infusing it into an ArcGIS map. So all those points are on a map that would be public forward, and you'll hover over scan and it'll tell you what scan does. It'll hover over the public health department, it'll tell you what the public health department does. You'll hover over, and you can filter them into services or support or whatever it may be. So this was an amazing tool that has been out there. They said that they've been working on it for the last 2 years. And I know for us here in the community, you all might be very much aware of the GIS map that we created out of the city of Laredo that infuses our overdose deaths that are also identified by sex and substance. And also the calls as well, and the administration of the naloxone. So with that, we're able actually now to take that information and put it into the tool that CDC has presented, and then it'll generate information like this, where social determinants will be pulled out, giving us this tool where we know in specific areas of the community where we need to address this situation firmly. Or for business, where support services can come in and provide this additional support. This was very new to me, being able to maximize statistical analysis software, SaaS. I'm very familiar with the management information system, but not how to manipulate it the way these analysts do, but they manipulated it to make it easy for us just to be able to click, do some drop downs, and get this type of data for us. So Jaime will be connecting with Mr. DJ next week on Tuesday, so that way the following session we will bring this back and give a demo to everybody on how we can use this to generate these types of reports from the data that we are putting into the system as well. So this will definitely be a collaborative effort for the organizations in the room to be able to enter the data into here, so we then can all put this link, and the link is my fault because it does work. We've seen it, and there's obviously an error here. The link does work, so we can be able to see it. Maybe by the end, while everybody else is talking, I'll try to figure out how to put it back on here. But that was an update on ORS. This one's a little tough to see, but I wanted to make sure to remind everybody about the high-risk substances waste water monitoring that we do. So we are looking at cocaine, we are looking at fentanyl, we are looking at methamphetamine, we are looking at xylazine in our wastewater. And this allows us to react. This is pretty much real-time data. Not necessarily, that's why I said pretty much, because we get these reports on a weekly basis from a week snapshot ago. So this information, as you can see here, we're looking at fentanyl use in the community. And at the very bottom, which is very hard to see here, it's December of 2023, the timeline. And it goes through May of 2024, basically coming into June. So you see that there's 3 different wastewater treatment plants here, and it is milligrams per 1,000 users in our community. That is this is fentanyl, this is the actual drug. So for some strange reason, as you're seeing here, they're throwing product into our wastewater, this drug into the toilets, right? And so as we connected with DEA, they're putting timelines together as to when they're getting hot on some of these trails, they see these spikes in the wastewater treatment because those persons are feeling that they're coming for them, which is good. We don't want that drug harming our ecosystem either, but it's not going to take somebody's life at minimum. So this is an amazing tool that we're working to send out our knock and talks, which of course we'll chat about right now too, deployed into different areas of the city. And what you're seeing here is that on the yellow line is South Laredo wastewater treatment plant. The green line is the Zacata Creek wastewater treatment plant, and the blue line is the North Laredo wastewater treatment plant. We do have 6 in Laredo, but they have to meet a minimum gallons produced to be able to be part of this analysis. So it's not just the drug that we're looking at, right? Because we also want to see the metabolite, what is being excreted from somebody's body, to know the usage and what's actually going on in the community. So here we have norfentanyl, which is the metabolite, which is when you ingest it and you urinate it or you defecate it out. This is what we're capturing here too. So this is also consistent with what we're seeing with fentanyl in the community, that is higher rates not significantly high when we get to cocaine right now, as we will see, but there is obvious use of fentanyl in our community. And this is what we're looking at, and this is where we take these knock and talks into these communities, never letting them know and never sharing, because we don't want to stigmatize them as well. What we want to do is help empower them to make that choice to get onto the road for recovery. This is on the cocaine side. So here, you can't really see, but here off to the left, you have on the y-axis, you have 40, 60, 80, 100 milligrams. Here on the cocaine side, you have 1,000, 2,000, 3,000, 4,000. So the consumption here is demonstrating that there's higher consumption of cocaine in our community. Not that it is a problem, right? But we know that this exists. And drug use is a problem though, but we're not trying to highlight our community as it has a significant problem. Drug use in general, we want to make sure that we prevent, that we educate, not to be there. And I'm seeing this as a tool because as you're seeing here, we have a higher level of cocaine going into the wastewater. But then with the metabolite, the benzoleucanine, you can see how they're also very high because there's obviously consumption of it by humans and being excreted into the wastewater system. What I'm trying to get at with this one though, is we know that there's higher use of cocaine. So the possibility of it being laced with fentanyl in that individual, unfortunately overdosing. We always say Laredo Public Health does not condone the use of illegal drugs or the abuse of prescription medications. But knowing that we have this high usage of cocaine and we don't want anybody to be in a state of overdose or ultimately lose their life because of the drug of choice that they're using wasn't the drug of choice that ended up being consumed. And so that's what we definitely want people to get out there. I think this is a great tool right now to be able to share with persons in the community, to trickle out into their social circles, to let them know, we see that people are using cocaine, but what we want you to know is that it could be laced with fentanyl and it could be your last breath. And we don't want that to happen. That's also why, of course, as I've shared in the past, we have advocated, and I would encourage others to write letters to our state senator, to our representative, about how the recent legislator in the 88th legislation, which we're going into the 89th, about the need to legalize fentanyl testing strips. As mentioned, we don't condone the use of drugs, absolutely not, but if you're going to do them, we want to make sure that you wake up the next day, at minimum, because that is a harm reduction tool. So this is on the cocaine side, the benzoleucanine, which is the metabolite, and then we also have xylazine. And we know that xylazine is a pretty intense tranquilizer, specifically for horses, right? But it is being used now in our human population, and it has been for some time for recreational use. A very scary situation, and in other parts of the country, you see zombie-like individuals. Pretty intense in the Northeast. I've seen in Pennsylvania, in the Pittsburgh area, how there's many individuals that are literally hanging on to pieces of infrastructure in the community because they are so high. And so this is something that we really want to, and this is also very low in consumption on the y-axis, but this is also demonstrating that in the month of March, in the month of April, and the month of May, this was being flushed into our wastewater treatment. But what strikes me odd and interesting, and I was trying to have a conversation, or I was having a conversation via email with members of the DEA and members of our EPI team as to why we don't see it in the metabolite, what is being excreted from the body. So we know it's here in the community, but we're just not really seeing it in levels where it can be recorded yet, and hopefully we don't get there by human consumption. With that, I wanted to transition over to Ms. Adriana, because we did have our second round of knock and talk in all districts of the community. And although we were sharing information, of course, about our substance use disorder resources in the community, but we know that mental health and substance use disorder are symbionts of each other, and we want to make sure that information about 988 was getting out, amongst other info. And as mentioned in the past, if your organizations want to walk with us, which is a very healthy practice, we encourage you all to definitely jump in and walk with us and share the information your organizations would like to get out into the community via a grassroots effort. And nothing shows more our connectedness than showing up at your front door. That is powerful all on its own. Adriana?
So.
Oh, thank you. Yeah. Sorry, more.
Thank you. So again, in the month of February, we conducted the first knock and talk with overdose. Here I have some black and white copies. Of course, we have the color ones where we share the overdose information. So it's a resource guide. It talks about the overdose signs and naloxone, our cabinets, and at the back it's the resources. Some of you are highlighted here, some of the resources and the agencies are here. So I'll be, if you want, you can have this ones around. We have both English and Spanish. If you want to grab one. That way you can keep it. If you see any mistakes on the contact information of your organization, please let us know. We made some changes already, that's why I'm bringing it up. So that was what we were doing in February. For the month of May, we started the initiative on the knock and talk, but this time for mental health. This is the brochure that we were passing around on mental health, and some of the resources are the same resources that you will find in the overdose flyer. And that's why, like Dr. Chamberlain was mentioning, it's really important for people to understand that substance use and mental health can go hand in hand. That substance use creates changes in the brain that affects the mental health of an individual. That there are mental health issues that are the root cause of someone's substance use. So it is really important to take these two issues hand in hand. So with that said, we went to every single district. We chose the highest population area of each of the districts, and teams went out there to provide this information. Knocking on doors, whoever opened, we had an educational encounter. So if you see in the screens, the first number is total houses, then the educational encounters and the total mile walk. So usually every district will have 3 teams. You can see in the screen, District 1, which is District Gilberto Gonzalez. We went on Monday, and that's the max of where the team was walking. Then you have, this is District 2 with 606 houses, 49 encounters. 3 teams went out for this one. On the following day, so this all happened in a span of 2 weeks. The following day, we went to District 3, 419 houses, 49 educational encounters. Even though the person wasn't home, we will leave a flyer and we will leave 988 information on their door. Right now, we'll show some pictures. That's District 4 with 411, 52 encounters, 6 miles. Then on Friday, we only had 2 teams, blue and red, that went out there to District 5. Then this is Thursday, District 6. This is District 7 with 2 teams. And this District 8. So as you can see, we went to all the districts, and these are the totals. So the house visited, or where we left, information on 988 and mental health were 3,805. We educated a total of 364 individuals. So this is people that are walking through their houses, or they're outside washing their cars. We saw them and we walked up to them. And even people that while driving, because they saw the yellow vests and we were at the community, they wanted to know what was going on. So some of the people will stop their cars and be like, what are you guys doing here? We took the opportunity to explain to them what we were doing. Total of miles walked for all of the teams were 45 miles. So here are some pictures of the work that we did. So as you can see, anybody that opened the door, we were there sharing and explaining what's inside a brochure, and where people were in home, you can see their fire department posting and just putting on the doors. People walking just down the street, also stop them and talk to them about it. Here are some pictures of the teams. So as you can see, the top one is fire department and the health department. At the bottom is fire, health, animal control, and the health department. Here we have roots, recovery, and animal control, and health department employee. And at the bottom, we have health department employee, PD, and fire. So as Dr. Chamberlain was mentioning, we're missing a picture of, there was a member of UISD that accompanied us as well on one of the Fridays, that unfortunately I don't have a picture of her. But as Dr. Chamberlain was mentioning, if any of you would like to go out on our next knock and talks, you're welcome to contact me. I can provide you the place, the times, the location, anything you need, and even the resources. So whenever we had someone like Fire or Roots come with us, we would have their packet ready with flyers, with their tape. Even if they needed a vest, we had extras. But since they were wearing really bright pink, we thought they were visible enough. So yeah, that's what we're doing on the Knock and Talk initiatives.
I just wanted to say, this definitely showed thousands of homes reached, dozens of miles, and what better way to connect with people. So we are very fortunate that we do have this public health promotion team, which is our group of community health workers, public health ambassadors that are out there, and you see them at different locations, but that are actually taking the message to the people. And we're very, very pleased with Ms. Adriana's leadership, and of course, the team for being out there, because, I mean, it's sometimes tough hearing the stories that people share with you, and you're connecting with them. But that's at the core of what humans are, right? We connect at the human level to make that change, to be able to provide that guidance, to share that education, and to help inspire as well. So.
And I can share one story. I go out with my team, and I went to a door, I knocked the door, and I am talking to this lady about the information, and she told me, "You're 1 month too late," and started crying. So I was reassuring her that this is the reason why we're out here, to prevent this from happening to anybody else. And unfortunately, she couldn't keep talking. She just turned around and went inside her house. But this is just one of the examples when we go to these houses. Another house, the lady, she mentioned, "Thank you so much. I was praying to God to see how I was going to help my daughter. She's about to move here to Laredo. She's been diagnosed with schizophrenia." So even though we would like to reach a lot of people, and some of these houses, their doors were closed, for the ones that their doors were open and where we had this education and information sharing, they were really grateful.
And so, as Ms. Adriana mentioned, and I'm sorry I'm taking up all the time, y'all, I apologize. You put a timer on me next time. We're going to be going out again very soon with the public health promotion specialists, and we're going to be layering, of course, with the overdose information, the mental health information, the next time around, because our utilities department asked us for support to get out into the community to let them know about water conservation. We're going to be pushing that out because that is a public health issue no matter what. We need our water to keep us going here in the community. And so we will still be getting out this information as we're going out with our responsible pet ownership. That's a public health issue as well. And the water conservation with these additional flyers. So if you all want to go and be part of it, please, by all means, everybody is always welcomed. I will hush up now. If you have any questions, let me know.
No, thank you very much, and as a matter of fact, there is no time limit for you because you are providing excellent information. I want to thank both of you and the whole team for going out there and representing this group because we all have different commitments and lifestyles that we may not be able to go out there, but I think our mission is being promoted out there. I will commit to the next one because I feel that it's a factor to make sure that we include Laredo Crime Stoppers as a prevention method and a way to call to report individuals in any which way, whether it's an abused animal, a neglected animal, or somebody who's selling drugs. It all comes into our Crime Stopper tip line and goes back into our law enforcement. So I'll make sure that we have that commitment there. If you me the dates, I will make an effort to be there, and then send out a team to represent as well, and then promote or provide any information that you may need, promotional items or, you know, snacks and things of that sort, to just kind of get people to talk to us. But I think that it is a great way to go out there. I know that, unfortunately, since our last meeting, I believe, if I'm not mistaken, there has been an increase in overdoses. So could you share the number? You have it on the top of your?
The most recent update that I do have is we've recorded 22. One life lost is one life too many. But I want everybody to continue to feel empowered to be those agents of change, because what we're doing is working to reduce the numbers. Because last year we ended with 66, and we are on this trend that we're at right now, mid-year at 22, and if we double, which we don't want to, it'll be 44 lives lost this year. That's still 44 lives lost. That number is 44. It is less than last year though, and that is demonstrating that our collaborative approaches, that us being loud is working, and it's making a difference as we will hopefully not get to the 44. Hopefully we can stay at this 22, and 22 is still a large number of persons lost. But we continue to do what we're doing, and we continue to elevate and scale up and add additional spokes of new harm reduction tools when possible. We will see this number continue to go down.
Thank you for that, and I completely agree with you. I think the human connection is vital, and I think this is a excellent tool for the information to go out there. So again, thank you very much. If there aren't any questions, discussion, for any of the groups or Dr. Chamberlain? Okay, we will go ahead and continue. Thank you so much, Dr. Chamberlain. Want to remind people to go out and get food. Don't be shy. Food was provided by Carolina. Thank you very much. So please feel free, if you're hungry or you want something to drink, that you're more than welcome to do so. We're going to go ahead and continue with the detox facility update report. Dr. Luciana Martinez.
Hello everyone. So, I'll just echo what Dr. Chamberlain said. We definitely don't want to continue to see anyone lose their life due to an overdose. This time last year, we were 42 deaths. So the efforts in the community in some way are beginning to show that they're working. We are at 83 admissions as of this week. We continue to admit. As a reminder, right, the center is for individuals 18 and over. They do not have to have a formal referral to come in. If you guys, want to send anyone over and they have a referral, that's fine. But if not, all we need individuals to know that the center's out there. That now there is a process. I know, agencies alike and individuals are getting, can get frustrated. But one of the issues, and Dr. Reyes was here a while back and shared that, is, we're not a drop-in center. So individuals can't just show up at any time and want to be admitted, which is what we're seeing a lot of. And really what we see is a parent, and take it, our average age is about 40 years of age on average. So we're seeing a parent dragging their 40-some-year-old child to our center while they're under the influence, and they want us to admit them right then and there because, and these are the words, ya no puedo con él, ya no puedo con ella. But we do give them all the information so that then we get them in the process to admit them. We don't have a wait list, okay? What takes the time is that they go through the process and do what, the labs that are being requested by the doctor, their TB test, which is one of the most important for us. So there's not a wait list, but it does take us about 2.5 to 3 hours to do an intake. So for the most part, we're doing 3 intakes a day. If somebody doesn't show up at the time they were supposed to show up, we call whoever, we start going down the list and saying, you were scheduled for tomorrow, or, for whatever day it is. Alright, the person that was supposed to come in is not answering. If you're ready, come in and I'm gonna give you that bed. So we do reach out to them, so that we can get them in if they were already cleared by the physician to come in. In the last couple of weeks, we have seen an increase of individuals with severe mental health issues. So we are working closely with our psychiatric nurse practitioner, and we're initiating them or restarting them and their medication, because as we all know, many of them, once they're back using, they stop being compliant with their treatment elsewhere. So we have been seeing an increase in individuals that come in and start off with crisis stabilization. I do want to remind everyone, our price to be admitted for crisis stabilization, the individuals also have to have a chemical dependency. Okay, so it's not just, we're not a psychiatric unit per se. But if they meet the eligibility, now if they're homicidal, suicidal, we can't admit them, but we have had individuals that come, there's voice suicidal ideations, and so then an intervention is done. We reach out to the crisis line, was it last week? Last week, we had one, Border came in, they deemed that the individual was safe to stay at the center because it is a safe place. And then they cleared her to stay with us, and then our psychiatric nurse practitioner stepped in and did the treatment that was needed. So we do evaluate them to see if medically and, in terms of psychiatric or mental health, they are appropriate for our level of care. Because we're not a crisis unit in that sense, and we are not an emergency room. But if they are stable enough to, be at our center, they will receive what is needed. Many of the questions is how long can they be there? We usually say on average they're gonna be there 2 weeks, but it varies. We have individuals that'll finish treatment in 10 days, and we have had individuals that have been with us almost 3 weeks. So it is based on how they're progressing in the treatment and what they need. But remember, we do provide integrated care because we take care of the physical as well as their mental states. Anything you guys like to share? So that's where we're at right now. We continue to collaborate and work with the community.
Thank you very much, Dr. Martinez. Are there any questions for Dr. Martinez? Questions, concerns?
I have a question. I'm with SCAN and we run the MAP program there, right? And so we do TB testing for the clients sometimes, depending on the circumstances. And I'm wondering if that TB test would be valid for admission to your facility.
Yes, our physician has informed us that if it's within a 3-month period, we can accept that one. Yes. Absolutely. So if your organization, because I know AMA also does them, so if your organization conducts TB tests on your patients, we can accept. If it's past the 3 months, he'll take it on a case by case because he reviewed things such as how transit are them in the sense, okay, is this someone who is homeless, has more of a higher risk? With a lower risk, then he requests that you get that, send us a referral, provide us a test with the date, and on a case by case, then he'll determine, if not, then we'll get another one. But yes, the answer to that one would be yes.
Thank you.
I have a question. I had an individual that was picked up by the judge during one of our drug court sessions, and the judge wanted him to get detox. So we submitted the referral on behalf of the client because he was already in custody. And then the sheriff's office was willing to transport them to the city or to the health department for the blood work. The problem there was that the sheriff's office needed an actual referral form or an order form for blood work to use to be able to transport. And so we were not able to get that. We ended up releasing the client, and she on her own walked to your center and had all that done.
Okay. So for that, in a situation like that, if you call us, we will give you
Okay.
the order. But we have spoken a couple of times with the sheriff's department, so we have let them know that if they're coming directly from being in custody, we can process them like that, and then
Okay.
once they're at the center, the health department has been helping us out, that if they come to the facility, they have come to the facility already twice to draw blood there. If something were to happen that they're really sick, right, then the doctor would provide something saying, right, that it's not the best, in the best interest, and then because it would put them at risk. But when they're detained, they would contact us and we would make the arrangements for them to come with us, because we know also that the sheriff's department does the TB.
Yeah.
And we can validate.
Okay.
So in that, but in the case that you would need an order, you would just call us and we would get you the order.
Perfect,
Mhm.
thank you.
Yes.
Any other questions or scenarios? Because this is the opportunity to be able to ask, considering that we all come from different agencies and we all collaborate. So it is a perfect opportunity to bring those scenarios to discussion. Okay, thank you so much. Dr. Shannon?
I was able to pull up the tool. Sorry, I wasn't gonna speak tonight if I didn't be able to show this to you. So here you're able to see Laredo, and right now this is something that CDC populated. So these markers that are here, what you see, it's like you'll click on it, and it'll tell you this is Gateway Community Health Center, which is the FQHC. Right here you have this marker, which is Roots Recovery Center. I'm gonna be transparent, this is the only marker that wasn't on there. I added this myself because, as mentioned, we can all add markers to this. What the cool part is the analysis through the statistical software. Once we start to import the data from PD, from fire, the administrations of naloxone, all those little details, then will make a big difference when we push out this report. Let's see, at the very top is where you can add the data, right? As mentioned, I was able to do it in the moment while I was there, because he was kind of guiding me through, but I want another round with this gentleman, which of course Jaime is setting up. So this is that tool, and which is great also because this is something that we're looking at here in our community, for our community to look into. But as you can see here, I mean, this is populated for the whole all of the United States, to be able to refer persons to support, resources, guidance, inspiration. That's what this is for, and this is an amazing tool. And so I wanted to make sure that we all knew about it. So I apologize for jumping back in again, but I wanted to demo this, and we'll go a little bit further into it at the next meeting to share with everybody how to maneuver the system.
Thank you so much. Moving on to the discussion and possible action to support a partnership between the City of Laredo and Webb County for the establishment of a family treatment court via potential grant funding. We have Mr. Victor Vasquez who will present.
Hi, good afternoon, everyone. I'm Victor Vasquez III, and I'm the director of the DWI Court and the Juvenile Drug Court for Webb County. I'm glad to see a lot of familiar faces here today, and my counterpart as well. Back here, she's part of the committee, and many familiar faces in the committee here today. So I'm here on behalf of Webb County, and in particular Webb County Court of Law 2, Judge Victor Varela. Back and forth through the last few months, we've had meetings with at least 2 council members that are interested in this, and as well as other stakeholders in the community that we are going to be inviting, and which is why I'm here today. I come here before you to ask and make a request to ask the City of Laredo to be a stakeholder in our upcoming application with the Department of Justice through in-kind funds. And that's not for any services that currently don't exist. It's pretty much for services already offered by the community. Webb County Court of Law too will be applying for the 2024 National Community Courts Initiative. And the name is simple, it's a community courts. It's a bringing in several stakeholders to apply for this grant. This grant isn't a large grant because it's barely starting off. It has about 3 years. It was initiated by the Department of Justice. It is for 4 years. It is due on July 1st, so we are working on it already tirelessly through the next few weeks. So we do, if you all give your blessing, we do anticipate to move it rapidly through the next council, just to make sure that they are able to solidify you all's decision. So what this grant does, it basically establishes or enhances a court-based intervention program to prioritize and expedite the provision of treatment and recovery services to individuals who are frequent users of justice, health, and other services who commit misdemeanor offenses. This grant also enhances the use of community services by participants in the community court docket, including case management, housing assistance, and service coordination. This grant will allow this community to develop and maintain a partnership and collaborations with service providers to enhance the provision of treatment and recovery support services. We are intending to also bring in stakeholders from the state. We are aiming to bring in Child Protective Services. What this court will be called the Family Treatment Court. It will service family violence offenders, harassment, assault, and any cases that are within the family violence threshold. We do plan on working directly with the jail to try and get them upon arrest. If you're familiar with the court system, it does take a few months or years for cases to go through. So we want to grab some of these cases to the point of magistration. The victim, at times it's a freshly done incident. So we want to be able to grab them at the point of magistration. That's our goal, and we feel that through this grant, we'd be able to utilize that. Of course, we traveled to Anaheim a few weeks ago. We were visiting California for a national conference of specialty courts, and there we got a chance to visit with the Department of Justice, and in particular with the two individuals that are overseeing this grant, Ms. Stewart and Ms. Madison, who are in Washington, and they will oversee this grant and they will oversee the application. And I asked my boss, I said, well, let's ask for a meeting. The only thing they can say is no. So we asked for a meeting, and fortunately they said yes. Us too, we were surprised. But we were able to meet with the Department of Justice, and we were able to ask if we qualified to apply for this grant, because we were just recently awarded another grant to the Department of Justice just last October, which is the juvenile drug court, which is established in Webb County, work that we've already started doing. They heard about us, they heard about Webb County, and they did tell us that no court in Texas currently receives or is a recipient of this grant. But they did give us the green light for us to apply. We went up there and we asked that it would be not only Webb County, but it would be through a partnership with many agencies coming together and really asking for these funds. It is a total of $900,000 for 4 years, but we feel that it's just a start and we can put them to work. If you give us $10, we'll put them to work. If you give me almost $1 million, I'll guarantee you we'll put them to work. We are no strangers with federal grants. We do have the SAMHSA grant, which is the DWI court grant. And we also do have juvenile court grant, which is through the Department of Justice as well. This would be the third specialty court that Webb County Court of Law 2 would apply for, aside from the other two that are currently already in place, that Ms. Committee Member Ms. And it also handles the drug court and veterans treatment. We're very familiar with Webb County with specialty courts, and the reason why Webb County is taking the lead on this is because we have the judicial jurisdiction over these cases, and which facilitates the entire process. Our request is the commitment for the city of $125,000 of in-kind for the total of 4 years. I can come up and share with the committee services that are currently offered by the city that would go as in-kind on behalf of the city of Laredo. For example, transit for victims, or transit through metro bus passes, the health department, if any services that they'd be able to provide, for example, HIV testing, or any STD testing currently that's done, or any mental health evaluations or anything like that that could be beneficial to the process, whether it be to the victim or to the offender, that we can work together and come up with something. So the total in kind would be $250,000. Webb County would be putting in $125,000 in kind. The request to the city of Laredo would be $125,000 of in kind for the total of 4 years. I hope that we can work together in this, and I hope that the next time that we come before this committee is to invite you all to be part of our first, either of the press conference, to bring in this grant to our community, or to our first court hearing. I'm available for questions if you all might have any, and I'll make my contact available if you would like to reach out to our office and hear more about this collaboration. Thank you.
Thank you very much, Mr. Vasquez. Are there any questions on the table? This is because it involves money. This does not necessarily go through us. I believe we have the support and I can take an action on that. However, it does have to go through city council, which we've already mentioned that you've spoken to two council members. Dr. Chamberlain, if I'm not mistaken, it has to go through city council and obviously review of financial commitments.
Correct, if I may, I don't have questions, but as you shared, I think this is a wonderful opportunity to continue to demonstrate that we are first always collaborators and never competitors in anything that we do here in the city of Laredo, because if we don't hold hands, like I said many times before, then we're not gonna bring these programs in. So I think this is absolutely wonderful. It would take council action to be able to, I wish I could say right now, yes. But unfortunately, that's not on me, and it would take council action to push this forward. Regarding the 125 in kind, I would definitely put together just some feedback, put together what you would want that 125, kind of like where it would come from, just so that council also has some guidance as to where those requests, and then ultimately city manager would then tell fire, would tell police, get with transit to execute the wishes of the council.
And what I'll do by the end of the week is I'll coordinate with the departments within the city that could possibly contribute into this in-kind match, and see that way you all give it a thumbs up or not, whether it's feasible by your department. We're also, because of the time frame, we're not trying to be creative in providing services that are currently not offered. It's basically services already offered within the community. But since it's called Community Courts Initiative, we want to have a strong application where we show that the community is coming together to apply for this, for these much needed funds to establish this family treatment court, Mr. Chamberlain. But in line, we would be with council, and we would be presenting a detailed proposal of how those 125,000 would be coming from the city.
I think that would be great legwork to do in the background, as you're mentioning right now, to contact the departments. I don't think it would also hurt. I don't know if you need letters of support or letters of commitment for this award. But yes, the city of Laredo as an entity would be wonderful, but I know you can definitely count on fire and police, to get them individually, so you have that additional punch. Besides, of course, our council and our mayor as well. I think that would just help to strengthen the packet, but I'm gonna let you all draft the way you wanna draft, but just know that you have that commitment.
And you'll have
from
those
us
letters
as a city of Laredo. You have our support.
Thank you.
Mr. Vasquez, is it already on the agenda for city council?
It's already being worked on for the next agenda for city council. Ultimately, what we wanted is the blessing of this committee. So when we went to the council, that wouldn't be brought up, that it wasn't presented here first. So of course, you all are the stakeholders of the drug and alcohol services that are rendered in this community. So we felt that it'd be best that you all hear it first.
Thank you very much, and I appreciate that, just like Dr. Chamberlain mentioned, and I reiterate that there is no need for us to reinvent the wheel when we have stakeholders that are taking action and working very hard for the same mission. So I appreciate that. At this time, I would like to ask for a first and a second, if there's no further discussion, for anybody who would like to agree in supporting the grant that is going to proceed with county court at law. I have a first motion, and I have a second. All in favor?
Aye.
Any opposed? Motion passes. You have our support.
Thank you. Thank you all.
And we have witness at council that I can say it on behalf of DAC, that DAC approves this as well. Be able to help them sense that.
I think that any resources or any funding that comes in from one way, shape, or form that helps support our community and keeps our community safer, healthier, I think there is no doubt that we want to continue to have those resources. And especially when you just mentioned that there is no court in the state of Texas that is taking advantage of this. This is something, it's a tremendous strike that I feel that hopefully other communities take advantage. One of the things that I say, like, if there's money, spend it, right? Because they're one and willing to give it, and we're obviously in need of it. So I thank you for, again, bringing that opportunity back to the Drug and Alcohol Commission, because we are a true representation of the city and the county.
No,
Thank you very much.
Thank you.
Moving forward to the public service announcement. Last meeting, we discussed doing in part with all the stakeholders a PSA and working towards a education and public outreach, again, going in partnership with the city health and all the agencies. I wanted to see if Jaime, maybe sometime next week, possibly on Thursday, whether the morning or the afternoon, you give me, because I want to make sure that you're included, so that you're a true representation of the city health. But that way the DAC has something to present, and then you say whether it's in line with what you're all doing. I believe Mr. Montemayor had mentioned the last meeting that he has a few contacts, and then of course I have a few contacts that are willing to work on doing, again, free public service announcements on behalf of the Drug and Alcohol Commission, because I want also, while we're all different stakeholders, that the Drug and Alcohol Commission is being represented. In addition, I'd like for you to also be in attendance if you're able to, because I know that last time you brought up that while it's not just substance, it's also alcohol. We do need to kind of work towards a campaign or a plan of different things that are happening, because we know for there's a factor of mental health, and then there's drugs, and there's alcohol, and there's just different drugs and different things and everything going on. So I think if we kind of pull together, and I'll get with Jaime, and as soon as Jaime can confirm, I'm looking at Thursday.
Yeah, I think that'll work. Just so you know it's the morning or the afternoon.
And then we'll either figure out if anybody else wants to participate, then we'll either have it here if it's available, if not at my office, or any other location that might be feasible for everybody to meet. We'll meet for an hour, bring in your ideas, and then we'll see what we could do, and not just bring in your one idea, but I'll send out an email to talk about maybe the next 6 months and what we want to discuss, or bring out in a public service announcement and then go from there. I think you've all been doing a wonderful job at putting this information out, including the knock and talks. So I think it's just a way of collaborating and just making it better. So if anybody shows interest, just let me know, wave hands, and then we'll go ahead and get that information out to you all.
Tomorrow?
No, June 20th, next Thursday. Alrighty, so if anybody else is interested, Ms. Angie will send out an email, and we'll go ahead and go from there. Thank you very much. At this time, we're going to go ahead and go over the stakeholder agency updates, and we already have the presentation from Mr. Victor Vasquez. Stakeholder agencies, you're more than welcome to share what your agencies are doing or any events that are upcoming.
I'll go first. Thank you, Angie, for printing this, Dr. Chamberlain, together with City of Laredo, Drug Enforcement Administration. All of these agencies here, they're gonna have a fentanyl family summit next Friday, June 21st. I think a lot of you all are aware. I know Mr. Kennedy was looking for people to have booths there. So I think some of the agencies are already signed up for booths. So if you're interested, you wanna let me know, I can tell them and see what we can do. There's gonna be service for 2 days. The first day will be on Thursday, but that's only for families that have lost a loved one. That one's gonna be at night, but this is open to everybody, so if anybody would like to go, you're all welcome to go.
Thank you. Earl, do you have any updates or any?
No,
Okay. Going around the table.
Yes, we have an event from our church on the 29th. It's a health fair that's gonna be held on 1701 Peaceful Meadow from 10 to 1. If there's any agencies, I already spoke to the fire department, Mr. Hurts, I know they're gonna be there. The city of Laredo are gonna be participating, the most with, different screenings. But if your agency would like to be there, everybody's more than welcome to just reach out to me, or, maybe after the meeting, and let me know. So we're working on the flyer that's gonna go out, so we could put all the information of the different agencies that, will wanna be there. It's a Saturday, it's the first year that we're gonna do it. Hopefully, we wanna record and everything for the following year, we could have a promotion and be able to, announce it, once we have the first event. We reached out to the sheriff department as well, so they could have like the IDs for the kids, and we're gonna be announcing also in the different TV stations. So if it's something that would interest you, you're more than welcome to join in and give out information of what you do, what you offer to our community, because I think it's important that we'll be surprised that even though like Grace Center, it's a we've already had 3 years and a half, but I know there's agencies here that have way longer, but there's people still that don't know the services they offer. So I guess for me, it's important for us to be there to be able to tell our community what we do for the families and something that could probably help them. Thank you.
Thank you very much. Any other updates?
Yes, good afternoon. So with WestCare, under the Drug-Free Communities Support Program and with Base Coalition, we're hosting some workshops through the summer for youth, and targeting anything either drug-related or opiate-related or even alcohol-related, mental health issues as well. So we have a date, we have an estimate date coming up after July the 10th. We will have a 1-hour workshop. We're looking for partners nonprofits who have youth in their groups that already have summer programs and they would like to join us. We would contact the partner. They will provide the workshop at no cost to our nonprofits here in Laredo. The location, if we need a large location, we'll look for this place here. If not, we can find another location. We'd like to do this throughout the summer to keep youth involved in things that they can be familiar with. The topic that we're looking at for this particular July is on synthetic marijuana and vaping of it. It's very popular right now. Vaping is very popular, but they don't realize that some of these things that they're vaping is related to synthetic marijuana and the damages it can cause to their brains and the development of their brains. So youth that we're looking at is between middle to high schoolers. And if you need any additional information, you can contact us for local time. And we can give you the details, or myself, I'm Eddie Smith, and we can give you the details. Again, it's provided at no cost, and we want to keep the youth informed. I know the summer months people don't want to hear anything about anything, but you never know, we might get a group of kids. We just got a group with UISD. We had it yesterday. That was 25 kids. They hosted it at Step Academy, so it was a good event. And we're looking to see if we can do something similar to that in July and in August, and then starting September, we'll start our ongoing DOC-based coalitions here at this place.
Thank you very much for that information, and if you don't mind, sending that information to Ms. Angie so that she can pass forward to
Okay,
everyone.
thank you. Thank you.
Anybody else?
Hi everyone, so I wanted to share on the harm reduction training series. So those of you participated on the harm reduction last a month ago know that we'll have another one. Now this one's on principles of harm reduction. The last one was on safety. This one is going to be the principles. I will have Ms. Angie send an email with this information and the QR code where you can register. It will be on June 26th from 10 to 12 here at the auditorium for those that want to take it in person. We also have the option of you joining us through the webinar. So we do have those two options. We want, participation for everyone. So if it's difficult for you to come all the way over here, you'll be able to have the opportunity to take the training online at the comfort of your office. So we'll have those two options. And you'll receive the information. I'll have it here in the front in case you want to register already. And then Ms. Angie will be receiving an email soon with the information. Thank you.
Thank you very much for that. I put it down on my calendar so I can be here for that one. Anybody else? Any other stakeholders?
Hi, yes, my name is Jessica Weiss with SCAN. Just to remind everybody that SCAN does have inpatient treatment for adults, for males and females, and for adolescent males for anywhere between 30 to 90 days. We also have various prevention and outpatient programs, as well as recovery support programs for youth and adults. So for more information, you can call us at our main office, 996-724-3177. Thank you.
Thank you. Mr. Hurt, any updates or anything that you want to share? I know you're hiding over there. You said, I'm not calling anybody. I know that you all put in a lot of effort on that side. Anybody that wants to share any information? I do ask that if nothing comes up right now, or that you're a little shy, but you have information as it comes, please share it with Ms. Angie so that she can forward it to all of us. That way we can all be informed. Anybody that shared information, I ask that you all send a flyer or a quick email with that. And I know that Earl has jotted down your information, and we'll be presenting it again at the next meeting on the minutes. Anybody else? Okay, alrighty. Then I will ask for a first and a second to adjourn the meeting at 12:47. Do I have a first? I have a first and I have a second. Quick.
I'll second. I'll second.
A second over here.
Oh, okay.
First and a second.
Trying to be fast.
All right, do I have